Welcome to Park Avenue Plastic Surgery Class, the podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Doreen Wu, a clinical assistant at Bass Plastic Surgery in New York City. I'm excited to be here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. This is episode 5 in our series, Lifting Without Cutting, where we explore non-surgical options for skin laxity. In today's episode, we are discussing Sofwave. I didn't realize how many options there are for this indication, Dr. Bass. What are we talking about in this episode?
Well, you're right, Doreen. There are many devices that doctors are using or trying to use to reduce skin laxity without surgery. I focused the attention in this series on the most widely used devices and treatments, mostly those with specific FDA clearances for lifting. In this episode, I've invited my friend and colleague, Dr. Jason Pozner, to talk about Sofwave, a treatment for non-surgical lifting of face and neck skin, which is one of the most recent additions to this category. Dr. Pozner's a board-certified plastic surgeon in Boca Raton, Florida, with extensive experience with a range of lasers and other energy-based devices, and an extensive practice in facial rejuvenation, both surgical and non-surgical. He's been a guest on the podcast on multiple occasions. Dr. Pozner, thank you for joining us again and welcome.
Thank you, Larry. Thank you, Doreen, for having me.
Okay, Dr. Bass, so before we get into the details of Sofwave, give me a history lesson.
Well, the first device that really focused in on using energy to lift skin and that was marketed that way, that had clearances from FDA for that, was Thermage. This was a radiofrequency device that came on the market in 2004. It treated one depth right at the skin underneath the skin interface, and it was a full field treatment. It exposed the entire area being treated. The next big device in this regard was something called Ultherapy, which is still on the market today and still used. This is micro-focused ultrasound. These are little dots of sound energy that go in the skin as a broad exposure and focus down to a tiny dot at a predetermined depth underneath. So this allowed you to do fractionated treatments at multiple depths, just at the base of the skin and underneath. And it also had visualization like the ultrasounds we use to look at people's babies and joints and things like that. And that came on the market in 2009. And in fact, Dr. Pozner and I were both involved in some of the development efforts for that. And more recently, we have Sofwave, which it also uses ultrasound, but in parallel beams. This exposes a single depth in cylindrical patterns, coming on the market in 2019. The idea is that each of these exposures creates heat, that the heat, that little minimal controlled injury that produces, stimulates the body to add collagen and creates densification of the tissues and some tighten up or pulling in all directions of the tissues between the skin and the underneath.
That gives me a pretty good sense of what the device does. So, Dr. Pozner, can you tell me about what the treatment process is like and how long does it take? What type of anesthesia is used?
Sure. So let's talk a little bit more about the history before I get into that. So, when the patients ask us about this technology, so I simply ask them some questions in return. So I go, have you heard of Ultherapy? Absolutely. So they said, what's the difference between Sofwaves and Ultherapy? And I always have my handy iPhone ready. And I say, Ultherapy is iPhone 1. Sofwaves is iPhone 14. Okay. New technology with a lot of advances over the ensuing many years. And in fact, I had the first Ultherapy clinical unit in the world in 2009. And we all did all of the studies, as Dr. Bass said. So with this process, I think this is on the easier side of treatment for patients. And I've had this done too. I did one a couple of weeks ago on myself. So typically with this treatment, I try everything. So typically with this treatment, the patient comes in, clean your face, take your makeup off, photograph them like we do for every procedure, and then put a numbing cream on their face that sits for anywhere from 15 to 45 minutes, depending on the numbing cream. Then we wash off the numbing cream and we put some ultrasound gel on the patient. And the ultrasound gel helps the ultrasound energy transmit into the skin. And then what we do is this transducer, the head of the transducer is 1 by 4 centimeters. So, like that. And then you just put it along your face, neck, brow, under eyes, and you leave it on there. And each pulse is 5 seconds. So it'll go 1, 2, 3, 4, 5. And then and then there's cooling at the same time. So Ultherapy didn't have cooling. This chills the skin, and then the pulse is for 5 seconds. And sometimes you can feel the 5th second, and then there's a 1 second post cool down, and then you move it, and then you do a second pass. So a typical face and neck takes between 30 and 40 minutes to do a full face with this. You can count the number of pulses.
Is there any recovery time after a Sofwave treatment? Is it a single treatment or a series?
So good question. The answer is, I don't know. We sell it both ways, as a series and a single treatment. I don't like selling too many things in series. I like to tell patients, do one, see what you like. If you want to do it again, we'll do it again in a month or so. And many people do return for a couple of these in a row, but I'm not a big series fan. And the answer to your previous question is there is zero recovery from this. You actually leave the office feeling and looking a little tighter, so you get some instant gratification. And you can go into our bathroom, put some makeup on, and go out for that 3-martini lunch, no problem.
And, I think that's an important point, though, that this is something where you can see improvement in a single treatment, because there are radiofrequency wanding devices that for sure you would have to do 5 or 6 times. Also comfortable, also easy to do, also no recovery. But you're not going to do a treatment and see what happens, because you're not going to see anything happen. That you're going to have to do a minimum of 5 or 6 treatments to try to get some kind of a modest tighten up going on the face. So this is really, even though you may choose to do more than one because you want a little more of a good thing, the notion is that one treatment is enough to get you some visible change.
And what I like about this is the patients are happy. So we've had probably 3 years into this device by now. We had among the first commercial units out there, maybe not the first, but I was within the first week or two of commercial release. And when we bought this, we didn't know what was going on. We didn't know whether patients were happy. And on the I was on the Ultherapy advisory board, and all the clinical studies with Ultherapy showed 20% of the patients had no response. Not a bad response, not a limited response, no response. And Ultherapy hurt. So many of the patients had this done, didn't get a result, told their friends it hurt, they didn't get a result. And that's not a good way to sell a procedure to your patients. With Sofwaves, we've treated a few hundred patients, and I can count on 2 fingers the patients that got limited results, 2 out of a few hundred. And interestingly, I just retreated one of those patients and she got a good result. So I think maybe didn't get enough pulses in that patient. But patients are happy. Not one patient has asked for their money back, and almost no complaints. If anything, they signed up for another one because they had an easy procedure that had a good result and they wanted another one with no downtime.
Speaking of results, how much improvement can I expect? Exactly what features are being targeted?
So this device is different than the Ultherapy device. And I think the problem with Ultherapy is, in retrospect, we were targeting too deep. We were targeting through the skin. Matter of fact, some of the patients worldwide that got the best results out of Ultherapy were patients probably with fuller faces with thicker skin. Some of the Asian patients did really well. I think they burned some fat and just slimmed out their face. But the thin-skinned Caucasian patients, I don't think it had much result on at all. Sofwaves focus down to a much more superficial level that's right in the middle of the dermis. So I don't care what your ethnicity is, you're going to get targeted in the middle of your skin. Doesn't matter if you're a millimeter thicker or not by different ethnic groups. So you're going to get tightened. So I think overall they were getting more efficacy. And what we've learned about the soft waves is the same lesson we learned with Ultherapy. The more passes you do, the more energy you put in, the better results you get. So we've kind of gone for a little longer treatment now recently, and we seem to be getting even some better results.
And, I think treating close to the skin is important. The concept of treating deep and taking ligaments that we know surgically have to be released in order to be repositioned is not likely to be worthwhile. I had always focused my lines with Ultherapy on the more superficial transducers and really scale back the number of any deeper lines.
Yeah, smart.
But the ability to treat, with minimal discomfort, the ability to treat a large area quickly has kind of led to some application of this technology in body treatments, because body skin tightening and smoothing is important and sort of an unmet need. And also more recently has resulted in a specific FDA clearance for cellulite. Isn't that right?
Absolutely. Absolutely. They just got clearance for cellulite. We're just starting to introduce that into our practice. This is a nice machine for your office. Again, it's the one thing is it's delegatable. I do a couple of these here and there, but we delegate this, and it's so safe that you really cannot get into trouble with this device. We had a couple of nerve injuries with Ultherapy that were luckily temporary, but you cannot get any injury with this. It just doesn't go deep enough.
And, overall, because when I look at all of these devices, I always like to ask this question: is this a wrinkle treatment in any way, or it's really a loose skin treatment, or is it a little bit of both?
I think this is a lifting treatment. And I think, when I look at lifting technology, I look at 3 different technologies for 2023 that we have available. One is Sofwaves, and I consider that to the left. That is the easiest treatment we do with no downtime and good reproducible results. I look at Elocore on the right as the most aggressive treatment, probably the best results, but really aggressive with some downtime. And I put in the middle the microneedling radiofrequency devices because you can target multiple levels and you can make that more aggressive than Sofwaves, and you have a little more downtime than Sofwaves. But I'm not convinced that the microneedling radiofrequency devices are any better than Sofwaves. Not yet. We need to have some head-to-head studies between them. But that's how I kind of explain it to the patient. So no downtime, extreme downtime, a little bit of downtime.
And what type of patient would you recommend Sofwave to? Who is the ideal candidate?
I think this is a younger patient that's not yet ready for a facelift, or someone who had a facelift looking for a little bit of improvement. I think if they're heavy jowled and have a lot of laxity in the face and neck, they're looking for an improvement that this device is not going to give them. And I think they're going to be underwhelmed by the treatment and unhappy with their result. But if you take someone with a little bit of laxity and who understands what they're getting into, I think they'll be very satisfied. And I think we've been very successful in choosing the correct patients. That's why we don't have a lot of complaints. There's lots of people out there who are new to this industry who, they'll take every 85-year-old with wrinkles and you're going to get a facelift result. And Dr. Bass and I are kind of old dogs in this. We know we know that money up front is going to lead to a dissatisfied patient and grief on the long end.
Yeah, I mean, you said something very telling, that we do these treatments and we work in aesthetic medicine and surgery because we'd like to make people happy. And so I always want to do treatments that make people happy, that are satisfying and fun for them, because that's why I went into this. And if that's not where I'm going to end up, it's not what I want to be doing, because it's just unhappiness for me and for the patients. But basically, I think there are 2 things about these technologies that are kind of important. One is, if even though you might respond if you have a lot of laxity, you don't get to the meaningful results stage. If you have a turkey waddle under your chin, and I take 20% of that away with a non-surgical treatment, 80% of it is still there. You still have a turkey waddle. you still definitively look like you're in a later stage of aging, a certain decade of life. And if you only have a little bit there, that can probably be well treated with one of these technologies. And so the result is much more meaningful. It's taken what's starting to look like it's aging and put it back into a quiet place. I think the other thing that's interesting is that a lot of other countries around the world use these kind of technologies very differently than we do. They start doing them very early in the aging process. Before there's much visible aging change, they're not looking for a visible change. They're looking for prevention. And they do the treatments once a year, twice a year, very lightly, not to look different, but to stay looking the same.
Smart.
And they go forward 5 years, 7 years more, looking the same as they did way back when they started. But, Americans are in a rush. We want a big change. We want it quick in one treatment. And companies want to sell a single, very expensive treatment. That's a better business model for them. And so it's left us with a little bit of a disconnect that we're starting to work around with some of these newer devices.
Especially, you're correct, the Asian countries are really good with rejuvenation. They've sold a lot of Sofwaves believe it or not, in Taiwan lately. But Taiwan is taking off like crazy. And I suspect the Asia Pacific, other countries are going to this is going to take off very soon. In Korea is a hotbed. Once it hits in Korea, that's going to be it. And then I'm not sure about its China approval yet. With China approval will be also good.
Lastly, Dr. Pozner, what takeaways would you leave our listeners with when it comes to Sofwave?
That this is an exciting technology that is cutting edge. And if you're looking for some pre-rejuvenation or a little bit of tightening in your face and you meet the right criteria, which is not needing a facelift, this is a great technology for you. If you go like this and that's your result you want, this is not for you.
Dr. Bass, would you like to add any takeaways?
So this is a transcutaneous energy treatment. In other words, the energy has to go across the skin to get to the deep surface of the skin and just below, which is the target area. So in order to do that safely, that means it's on the lighter side of treatments. But the Sofwave technology treats a much bigger volume of tissue than preceding, more fractionated technologies at that single depth that's probably most important. As I said, because it's lighter than other treatments that are in micro-invasively or minimally invasively putting energy into or under the skin, it's for earlier stages of aging. And the best use may well be that prevention and maintenance more than restoration. But that requires us as Americans to rethink our game plan a little bit. And finally, I agree 100% with Dr. Pozner. In the presence of obvious hanging skin, it's simply not a good option. That's the place where something surgical is going to be much more effective and much more meaningful. So I'd like to thank Dr. Pozner for joining us yet again on the podcast. He just has a wealth of expertise in all things device and all kinds of non-surgical options. So I greatly appreciate him joining us and sharing it with us in such a forthright fashion.
Thank you for having me. Hopefully I'll be on again.
Thank you, Dr. Pozner, for coming on yet again and sharing your extensive device experience with all of us. Thank you for listening to the Park Avenue Plastic Surgery Class podcast. Follow us on Apple Podcasts, write a review, and share the show with your friends. Be sure to join us next time to avoid missing all the great content that's coming your way. If you want to contact us with comments or questions, we'd love to hear from you. Send us an email at podcast@drbass.net or DM us on Instagram @drbassnyc.